Antibodies, and welcome back to the Radical Goat. I'm Anne-Sophia, and today I'm here with Tics. For this video, we will be discussing PANS. So to start with, what is PANS?
PANS is Pediatric Autoimmune Neuropsychiatric Syndrome, and its variation of Pandas is Pediatric Autoimmune Neuropsychiatric Disorder associated with Streptococcus or strep-throat. And in adults, this is called autoimmune encephalitis. Now, for PANS or Pandas, there's a serious infection for Pandas, Streptococcus, or PANS. A wide variety of other bacteria or viruses could start it, but the body steps up, attacks that infection, but goes overboard and then starts attacking the brain as well. There is no noticeable difference between PANS or Pandas. They have the same symptoms and the same suffering, but they just have different triggers.
So what have your experiences been with PANS? PANS.
I've had PANS all my life, but I only started showing more serious symptoms at around 10 or 11 years old. When I was about that age, I got a dry cough, and doing simple tasks like doing the dishwasher or making my bed would send me into a coughing fit, and the only thing to stop that fit was for me to sit down, watch TV, or play a game. Now, we went to a couple family doctors, and they sent me for an asthma test, and they also gave me antibiotics. But I passed my asthma test with flying colors, and antibiotics did absolutely nothing for me. And besides that, they taste disgusting. But after a year, we found that by doing brain-stimulating flashing lights in glasses, we were able to suppress the cough, and we managed to get it to stop after about 8 months to a year. Now, as time went on, I got more and more tired by doing normal activities such as playing, running, dancing, etc. I just would get more tired than the average person. And school also kind of went downhill. I couldn't focus on school, and I could barely read or see the material in front of me, and I would distract myself during the time that I was supposed to be doing school. Now, I also got more and more anxious, more overly emotional and sad, and I also started biting myself quite often. And I also started getting angry and scared at very little things that most people wouldn't even come up onto their radar. Now, right around the time I got seen by a neurologist, a person who studies the brain, and about the time I got diagnosed, I started getting what's called Myoclonus, or groups of muscles spasming, and what that would look like is my head rocking from side to side, my body would be tensing up and shaking, and that experience was quite terrifying because I would lose all sense of sight. My hearing would become muffled, couldn't see very well, and my thoughts were non-existent, and I couldn't even talk. The only thing I could maybe say was directly before the attack was, "Oh no, I don't want this to happen." Now, other kids and me, I've also gotten a couple of these symptoms, but some kids also can get OCD, over compulsive disorder, and that can come in the form of tapping something over and over and over again, switching lights on and off, or doing repetitive motion over and over and over again. And kids can also get tics, or small jerky movements or actions, and that can come in the form of touching your ear or your face, or a small spasm of muscle in your face, or it could come in the form of a verbal outburst. In any case, it's an uncontrolled action by the person who has it. Kids can also get symptoms such as wetting the bed, headaches, stomach aches, decreased penmanship, and the decreased ability to do math.
So what kinds of treatment methods are available for PANS or Pandas?
Well, personally, I got what's called sub-QIG, or subcutaneous immune globulin. Subcutaneous means under the skin, and immune globulin means basically an antibody, or the little things your immune system makes to attack viruses. Now, the antibodies get pumped into me through either the skin, and it suppresses the production of my own body's antibodies so that those antibodies stop attacking my brain. For if the body assumes that we have more than enough antibodies to go around, we do not need to make any more antibodies. Now, every week I usually get 4 needles into the stomach, and each week it rotates side to side to side, and I get this for 6 months ending this July. Now, a person can also get IVIG, which is the same thing but just through the veins. But the reason why I didn't do this version was because such a fast injection of those antibodies can cause severe headaches or stomach aches. Now, another treatment a person can get is plasmapheresis. The plasma in the blood gets taken out in a machine, while the blood gets taken out. Then in the machine, the plasma gets removed. Then the blood moves along, more plasma, or newer plasma, or similar substance gets added in, and then it gets added back right into the body. Now, this generally takes about a week in the hospital. Now, sometimes, not for all kids, but for some, the tonsils may need to get taken out because a bacteria or virus may decide to host itself in there. And if you don't get it taken out, it will be a much less chance of getting better. So sometimes that may need to happen. For most PANS or Pandas, probably don't need 6 months of treatment to get better, but because I've been sick all my life, I need longer treatment. So basically, longer treatment, or longer time you're sick, the longer you're going to need to get medication to help you get back. Now, you also probably going to need what's called antibodies, or not antibodies, antivirals or antibiotics. If you have a virus that your body hasn't, a virus or bacteria that your body hasn't taken care of already, you're going to need to take an antiviral or antibiotic. The antibiotic is for if you have a bacteria that your body hasn't gotten rid of yet, and the antiviral is obviously for a virus.
So what should people with PANS or Pandas be more watchful and aware of or try to avoid?
Well, food allergies are a very major thing. Food allergies can inflame PANS, and not all people may have a food allergy, but it's worth checking out because that can really set back the recovery process. High-stress environments or decisions should be avoided at all costs because this may trigger attacks or increase stress and bucket load of other negative effects. And obviously, normal things such as sleeping well, eating well, drinking well are all very good things for the body.
So what advice would you offer to people who don't have PANS or Pandas or know someone who is undergoing treatment?
Well, PANS cause dramatic behaviors outside of what their personality may be. If a person is angry, simply weather the storm. There's nothing they can really do about it. And if the child is having a shaking or myoclonus attack, the best thing to do is don't panic. Hold them, hug them or hold them, or that's basically the same thing, but be that grounding influence while their world is basically spinning. It will be the best you can do for them at that time. It will make it less scary. It may not stop the attack, but it'll make it much more comfortable experience for them. And if they have a reaction of exaggerated anger or fear that maybe isn't rational, don't tell them they're crazy or try to reason through them or try to discipline them for an unsafe reaction. It really won't work, and it will just make them more frustrated than they already are. Now, it's up to the judgment of the parent or guardian taking care of the child, but it may be best to pull the child out of school. The workload given to students may be borderline impossible for the child. Because of the brain problem, some connections may not work, and some studies may just be frustratingly hard to try to get through. The stress of school is also an inflammatory thing for PANS, and children can be just mean to kids who may seem abnormal.
Are there a few specific points you would like to emphasize on the matter?
Be understanding, give them confidence, be the support in the midst of the chaos in their heads, and above all, have an open mind and heart about what they're going through.
Is there any other commentary or advice you would like to share?
Well, going through PANS or Pandas, especially if you haven't been diagnosed, can be terrifying, confusing, and rather hellish. It can seem like a roller coaster that you can't control and it's going much too fast for you to comprehend. Just know that you're not crazy, and this isn't a testament to who you are. And with the right help, you can go back to yourself, or get a bigger, better you than you would have ever imagined. Now, until then, hold on to the people who love you, and don't let go. Ignore those who are negative, because only you really know what you're going through. And don't worry, before you know it, the storm will pass. So hold on.